that we're seeing in the hospitals? Because I think people are not realizing the seriousness of the situation that is happening at hand at the moment.
Look, I think one way of explaining it is to say the mood, in our corridors and in our wards is extremely somber simply because you are not just looking at yourself losing the battle, but you're also looking at your colleagues around you losing the battle as they also contract this condition and some even succumbing to it. And it's really, it's killing the spirit of wanting to continue and fight, because you are aware that you're not just putting yourself at risk, but you're putting family, the community that you get into the taxi with and commute with, the people that you meet even in the shops. I mean, it's a very difficult situation because the patients that you could save if you adequate resources, material resources, all required oxygen supplies. If you had that, that many lives could be saved. But the reality is some of them you can't save them because of the shortage of this material resources. You also know that if we had more hands on deck, had more nurses who are helping and the ratios are correct, you could do more. But you're also appreciating that a lot of these nurses are at home. They remain very much unemployed, and those who are continue to work are actually at a point of burnout and even serious psychological strains of different kinds. So to be very honest, the mood is really, really somber whilst looking at this very dire situation of breaking point of our very frontline workers that are supposed to defend us.
Interesting that you say that, there are many nurses sitting at home. Why is it that government has not played a part in actually funding them and getting them involved to be able to make it easier for you? Because the more hands that there are, the more patients you can see to, and the more efficiency and effectiveness will take place within that particular instance.
Look, the reality of the matter is that even before COVID-19, our hospitals were still in ICU,
Yes.
and we were looking at a healthcare system that was in a crisis mode. You would have expected that with the funds that were pumped into the COVID-19 pandemic, that we would be seeing a lot of wards erected in our hospitals. You would see a lot of hospitals in our provinces and in our regions, but that has not been the case. But it all points out to lack of political will. There hasn't been any form of, a decisive leadership that we've seen during this pandemic. We are just a country dependent on lockdown, and lockdown alone without plans is a useless lockdown, because you're not getting out of this lockdown with infrastructure, with more material resources, with more human resources. And maybe to answer the question of why are nurses sitting at home, I mean, it's so sad that year in and year out, we look at nurses that are trained with taxpayers' money being let go by our government to go and, fend for themselves, or go and work for private sector, or even go overseas. And for us, it tells us that we are a country in the healthcare system that doesn't know how to plan properly. So this is a historic thing of nurses not being employed and ending up finding different ways of, feeding their families. But now in a pandemic, there's really no excuse why we cannot we have them on the sunk roll. We know who is employed and who is not employed. We've got databases, but our government, it seems, turning a blind eye at employing this workforce that we so much need.
I think that needs to be brought a lot of attention to. Sibongiseni, talk to me about your situation and how do you feel about this? I mean, I'm sure it's been as difficult for you as it has for Lerato. Definitely a very heart-wrenching situation, because you're standing there on the front line and literally, like she's saying, there's lack of resources, lack of support structure, of course, a lack of nurses. How are you dealing with the situation? Looking there, feeling helpless when there's a particular patient that you can't reach out to due to a lack of all of these things?
Well, that's the everyday story. For starters, I need to just clarify. I'm the communications officer at DENOSA.
Okay.
Of course, I'm a communicator by profession, but I work with nurses, we interact with nurses, we support nurses in their work. I think Lerato has said it mouthful. What nurses are going through in this country needs to be relooked. In fact, we feel that nurses are giving themselves way too much because there is this expectation that nurses must always be deliverers of miracle. They always have to improvise on the ground because of the shortage of resources, the shortage of nurses. And these issues have been outstanding even way before COVID. And now we've got COVID. We are still complaining of the same issues. And it depresses us when you see government not showing any willingness to support the healthcare workers, particularly nurses. What is even worse is that even when it comes to preparing for the crises like this COVID, you find that the voice of nurses is not being listened to. We've always said, when we say include nurses in your decision making, we are not saying they must replace anybody that you deem to be necessary to serve in those structures. But include nurses, because if you look at nursing contributes about 80% of contact between patient and healthcare professionals. And that is the extent to which nurses contribute to the delivery of healthcare services. If we don't look into this issue or the essence of employing more healthcare workers, we're not thinking that healthcare workers will be able to actually, deliver us from the first and the second wave. It is by miracle that they really managed to do that. And of course, because now there's this expectation that nurses must be deliverers of miracles. It looks like any complaint that we are raising is not going to be listened to unless perhaps we really think about the input that we are putting to the healthcare service. Otherwise, nurses are depressed. In fact, they are depressed and nothing is being done to assist them. Some of them are attending psychological counseling out of their own pockets. And some are no longer interested to serve this government, which is not caring. And some are looking into opportunities overseas. And that is a loss of critical skills in this country. But obviously, if you do not know the importance of the critical skills that you are having, you're not going to care whether people are living or not, because the focus is to save as much as we can. Because there's this attitude by our government of looking into care services as an expenditure instead of looking at it as an investment. There's so much focus on the economy as if the economy comes first before the health of the people. There is no economy without people being healthy. In fact, COVID has taught us that if you do not look into this matter of the healthcare system, it is not going to serve one economy that you are so focused so much into. Therefore, we need a paradigm shift in the mindset of power that be that healthcare system. The more you invest in it, the more you are going to grow your economy. Studies have proven that worldwide.
I so agree with you there. Lerato, what sort of support structure do you think government needs to put into place? And how has the health department reacted to you if you have asked them for help in any way whatsoever?
To be honest, have grossly disappointed us when we needed them the most. And this was during the pandemic. Like I said, we really do not have decisive leaders in sitting in and occupying high echelons of the healthcare system. And what is required is really simple. It's just three major things. One being that we need more infrastructure that is going to deal with communicable diseases and infectious conditions, like we did with 2010 World Cup, where today they are still pointing at those stadiums, at those roads. Is the same thing that the healthcare system needs, of being able to cater for infectious conditions, even post-COVID-19, and also to be able to deal with all this increasing pathologies and the disease burden that we've always had, but in a better way. The second thing, employment of healthcare workers, we cannot be going with the same model that they are currently using, which is having COVID-19 posts. We don't need COVID-19 posts. Our healthcare system was in trouble. We need people to be occupying permanent posts and replacing those who have died in the line of duty, those who have retired, those who have died. We need to look at the proper patient-nurse ratio. So staffing cannot, we cannot say Treasury is holding the post. It cannot be an excuse for getting nurses to come and aid the patients that are dying right in front of our eyes when we could be saving them. The last thing is obviously making sure that the processes and systems are tightened up. We've seen the corruption and the looting happens with the PPE. We've seen, it was all over the media. We've seen just how things that are supposed to get to our people are not getting to our people in our facilities, simply because some people out there are enriching themselves. It's not fair. That's not what we need. What we need is a system that are going to ensure this material, resources that we are in so dire need of, PPE, oxygen cylinders, masks, ventilators, all the things, because we are dealing with the respiratory conditions, are there at our shop floor, and we are able to help our people, really, to be honest. And I think that the final thing is to see a government that doesn't only institute investigation of SIUs and so forth. We need a government where they smell corruption, they act decisively, and they clamp it down, and we can save more lives.
Most definitely. Sibonge Seni, describe to us the situation right now in the hospitals as we're hearing. There's an overload. There's no space for any other patients. Ambulances are lining up. There's absolutely nothing people can do. Some people have been sent to other provinces, so we're hearing. What is it like? I want you to paint this picture to our listeners, because we want the listeners and government to understand that we now need to start getting up and making those differences and taking a stand to be able to help start saving those lives. It's not just talking about it, but putting that action into place.
Well, the situation is quite dire, and it has, as you just mentioned. Look, when you look at what is happening on the ground, particularly in Gauteng, what has caught it this way, it has caught it unaware. And it demoralizes and it depresses us that we still don't have your field hospitals. What is currently happening is facilities have run out of beds. Of course, from time to time, you find that there's still some space, but the referral system needs to be relooked into to ensure that patients are referred to where their spaces. You find that patients are in long queues and they're waiting for beds in facilities where they've been referred to, even by GPs. And now that is the burden of nurses. Now nurses must now all of a sudden find beds that are not there in the facility. And the work of nurses is not to look, run around in first facilities. You need to have proper plans. Management must plan in facilities to make the work of nurses, conducive and bearable. What you find is that the situation in the third wave in Gauteng is the same situation that we had in the Eastern Cape. In the Eastern Cape, you had the whole province running out of beds. And those who are fortunate enough to afford private medical services would be referred by their doctors to the nearest provinces, like KZN. Because the referral facility, mostly your private hospital in East London, you'd find that it's full. And in the eastern side of the Eastern Cape, you'd find that where most people are reliant on the Nelson Mandela Academic Hospital, it was full. We are reaching that situation in Gauteng, and the pace at which preparing for more, in terms of space, is very slow, and it is depressing. Now, our unfortunate situation is that the public, because you need to educate the public, at least they must obviously behave in a responsible way, thinking for themselves and also thinking for their family members. You find that, look at the numbers of the infection. Gauteng, the numbers are skyrocketing, and it is very scary, and we have not even reached the peak. Well, you can just imagine how far we will be when we've reached the peak. And the situation is dire, and we know that government do not want to entertain the question of field hospitals. It eludes us as to why this is the case. Of course, that's because they are still looking into it as with the eye of it as an expense. It's going to cost many lives unnecessarily. And it's even worse for nurses, because the more you admit patients in facilities, Most of them is because the elderly, because of our poor and slow pace of vaccination program. The elderly would need higher care in facilities.
Sure.
And we don't have enough ICU trained nurses in this country. Now our facilities will end up deploying nurses to work in ICU, whereas they're not ICU trained. And that is out of order. It's unacceptable. Now, the problem is leading to the other. And I do not want to depress you more, because as we're looking into COVID, we are neglecting other areas of services. I mean, 70% global, and the research has been done. Globally, 70% reduction in community routine vaccination, and about 69% reduction in non-communicable disease services. You talk of a reduction in malaria diagnosis, reduction in cancer diagnosis and treatment. You've seen what happened at Charlotte Maxeke. So we are dealing with the COVID-19, but at the expense of other services, because government does not want to hire more hands to ensure that we are dealing with this effectively.
Yeah, and we're hoping.
I think our appeal to communities to really, we know how strenuous this period is. In fact, they have behaved very well, to be honest. Let's be fair to them. They have behaved very well, and the time at which they left and they got tired of complying, it was a time that ordinarily the vaccination program would have assisted. But because of the slow pace, it's not assisting. Therefore, I think at some point government must take the blame.
Most definitely. Lerato, coming back to you, would you say that it's important that we ask government to open up some extra field hospitals and hire those nurses to be able to create a better situation so that they can start dealing with the problem at hand? Another thing is, I think it's important for government to understand that a lot of the people have not been educated enough, especially in the rural areas and the townships, about the pandemic itself. And that is something that they need to understand and go out there and create their education and awareness, even if it's through TV or getting people to go out and explain to people the dire situation. Because as we're seeing, people are walking around without masks. They are walking with, they're not sanitizing enough. And when I was speaking to many people that I know from townships, I got the understanding is that they really don't understand the pandemic very well. So do you think education and awareness and, of course, extra field hospitals and extra staff is going to make some form of a difference?
Look, simply put, when it comes to community education, it's a need. It's something that cannot be ignored. However, I want to shock you and tell you that the very education that we have been advocating for is for the very healthcare workers. So from the get-go, we felt strongly that our healthcare workers were again left to find out information in social media, in the internet, in various websites, even international, on even what this pathology is about, what are the pharmacological intervention that is required, and just nursing processes that needs to be put in place or intervention to nurse this patient. So, it was your, find out yourself. Now, imagine you are expecting a healthcare worker and nurse to become an ambassador, either vaccination or of a condition, and you have not even trained them, you have not signed them competent on it, you've also not been in servicing them on it. So you see, who will go to the community and educate them about a Delta variant strain when they themselves are just finding it out and they are just, piecemealing as they go along? It's really been an unfair period and an unnecessary burden that we put on top of our healthcare workers, simply because we wanted to just, be in a rush for everything. And I mean, when I talk about this, I even think the way the rollout had so many impediments, had so many problems, it gives you an impression as to just how politicians are really running with this thing, where they see money, but they are not necessarily taking the healthcare workers, the experts, the researchers and the clinicians to take charge of running this program. So it's so much meddling, so much political meddling that it has cost us so many lives. So yes, we do want to go and teach the community, make outreaches and make sure communities know But we also need to remember that the people that you're asking to go and teach them themselves need that particular education.
A pertinent question. Would you say communication is key? Because I think from listening to your stories from Sibongiseni and from yourself, that there's a lack of communication between department and health workers.
That's a very toxic relationship that the government has with its employees. I will be very honest with you. It's toxic in a sense that, just a day ago, I got a call from Rahima Musa, Mother and Child Hospital, and the nurses were saying, we left the ward in the morning with mothers that just gave birth. We came back and we found that it was only COVID. It was turned into a COVID ward.
Sure.
And no one told you that this will happen. They say we have not been trained how to stop and don. We don't know. We're not saying we don't want to treat this patient, but at least the minimum, a WhatsApp message to say, look, just know that this doesn't change. So there's this a culture, a very toxic culture of top-bottom directive, where politicians will decide, or managers, or whoever from head office will then decide and say, we want this turned into this. But those who are working with this, those ones who are expecting to work and deliver the service, you are not even talking to them. So it's a broken relationship that has got a lot of toxic strain, and there's no communication. It's just, rules, and it's orders and orders and orders from above, and that is costing us a lot.
Right. Sibongiseni, I think you'd agree with Lerato here and say very quickly, we're running out of time, that I think we need to start creating communication keys with government and with, of course, yourselves, because you're there in the front line experiencing everything there, knowing best what it is that you need and what the patients need and what you yourself, the health workers need as well, to be able to make the situation easier and get going on creating a better health service. Would you agree on that?
Well, indeed. I think communication is key. And I think the extent of the problem that we are faced with is, instead of uniting us with the government, you'd notice we are further drifting apart from each other. In fact, we are avoiding each other now. How nice would it be that we had a Department of Health in this debate, because these issues are concerning, the level of, the quality of service that government must provide, and government is expected. And the government is committed to providing to communities. But obviously, we are rarely finding that we've got the Department of Health in this debate, because they are running away. In fact, they know what is wrong. It's just that there's no willingness to actually addressing it. Now, communication is very key, and we are very unfortunate that, of course, healthcare workers must be the ones who are expected to deliver qualitative services. And healthcare workers have to ask questions where they need to ask questions. Because those questions will be asked of them by the patients, and healthcare workers want to be perfect with their work.
Okay.
They don't want to be undermined. They want to be perfect with their work, but they can't do half prepared services.
So Sibongiseni and Lerato, would you say it would be fair for us to ask and plead to the health department and government to say, please reach out to the nurses, get first-hand information from them, and then follow the processes from there that need to be followed?
No, definitely. I think that is needed. But at the same time, when you listen to responses from government spokespersons and officials that represent the department when they engage media, you would swear that someone is being accused of cheating. No one seems to be coming to take responsibility and say, yes, the situation is in this manner, and this is the steps that we are going to do. It's every time a PR exercise, and it's them talking in their defense when even, patients, as they walk in, they can see that this is just that there are no beds, we have no capacity, you cannot put a bed next to a where there is no oxygen point. We need hospitals, we need more work in our hospitals, and that cannot be PR in any way or in any fashion.
Right. We seem to be running out of time. But the thing I want to say before we end is I think it's imperative now for government nurses, and the health department to work together to be able to come and find the correct processes that need to be put into place in order to be able to create a better situation. Because as we know, every single day the situation is getting rather worse. And we do understand your plight. And I'm glad that we've had this conversation with you this morning to be able to bring light to government, to the communities, and of course to NPOs also, to see how everybody can fit into this puzzle and try and help make the situation better than what it is right now, and to try and ease off the situation that we're in through those many things that we've discussed. But before we leave, I also want to, from behalf of myself and the team and the communities out there, commend you on the type of work that you've been going out, putting yourself on the front line and trying to make differences and saving as many lives as possible. So thank you so much to Sibongiseni and to Lerato for joining us today. And we are also going to be praying for you that, of course, that you with us reaching out to you today, that those processes get firstly put into place, and secondly, that you stay safe. So thank you so much. Do take care of yourselves. And we want to create a big shout out for you this afternoon to say thank you from myself and the Salam Media team for going out there and doing the best that you can, irrespective of the challenges that you have been facing.
Great. Thank you very much. We appreciate it.
Okay, thank you so much, Lerato and Sibongiseni. Do take care of yourselves, and a big shout out from myself and the team. We love you guys for all the work that you're doing. Do take care.
Sure, thank you. We love you too. Bye-bye.
Bye-bye. Sibongiseni and Lerato talking to us about the dire situation being faced by nurses and the plights and the emotional impact to try to understand their situation, saying that they're in the situation where they're literally looking at people dying because there's a lack of resources, there's a lack of communication. We are from ourselves now pleading to department and to all the key role players to say, let's try and work this out. Let's try and work the proper processes by form of communication. From myself and the team, that's what we have to say. I want to end off by something that's been said by our beloved prophet, peace be upon him. It says, the best of you are those who feed others. The best of you are those who benefit people the most. And the best of you are those with the most excellent character. And the best of you are those from whose tongue and hands people are safe. So we're saying today, let's try and go out there, make those differences, and definitely hoping that this has shed some light onto the situations that we are facing. And we're going to definitely put something together as far as government